Honorable Deputy Chairman, sir, thank you for giving me the opportunity to speak on the motion of thanks on the Honorable President's address. Sir, I am going to talk only about health in the President's speech, and I would request Leader of the House and our Honorable Health Minister to please listen to my suggestions and comments and try to take the corrective. Honorable Deputy Chairman, sir, thank you for giving me the opportunity to speak on the motion of thanks on the Honorable President's address. Sir, I am going to talk only about health in the President's speech, and I would request Leader of the House and our Honorable Health Minister to please listen to my suggestions and comments and try to take the corrective actions as much as possible. As I begin, I would first appreciate the efforts of all governments since independence that have significantly improved healthcare in our country. This progress is evident in the success of universal immunization, the eradication of smallpox, polio, collective COVID management, and the overall increase in the life expectancy. However, sir, I rise today to highlight the critical gaps making our healthcare system affordable. Sir, that demands urgent attention. Healthcare is not a privilege, it is a fundamental right. Sir, affordability of health is still issue in our country. As per our data available, around 7.5% families in India are pushed into poverty because of one critical healthcare issue in the family. Sir, budgetary allocation is too less as far as health is concerned. In 2017, one of my colleagues had also pointed out, Mr. Mittal, in 2017 National Health Policy, it was said that 2.5% of GDP will be spent by 2025. Sir, still only 0.27% of GDP is being spent, and 2% of total budgetary allocation is going towards health. So my request is to go, and there was a SBI report recently, State Bank of India report, which says that it should be 5% of GDP. But sir, I would request to use your good offices. I would like to, through you, I would like to request Honorable Health Minister to use his good offices and try to get as much budget as possible for health so that affordable health care can be provided.
Thank you.
Sir, it's 5 minutes.
Go ahead.
Acha. Sir, next I am coming to out-of-pocket expense. Sir, the last data which is available on the government website, it is 39.4% is the out-of-pocket expense, which I beg to disagree. First of all, this data is from 21-22, which was a COVID year. And most of the expenses were being taken by government. And also, hardly patients used to visit hospitals for the fear of visiting hospitals. In Uttar Pradesh, the official number of out-of-pocket expense, which is bigger than many countries, is 70%. Sir, the world average is 10 to 12%. Now, some of the African countries which got independence along with us, Botswana, it is 4.3%. South Africa, it is 5.51%. And the data source is WHO, sir, before. I mean, what I am trying to say is, sir, I am on vice president of one of the institutions.
Okay, Mr. Arora, you will resume. I'll allow you to resume later on.
Okay, okay.
Honorable Dr. Jaishankar. Sri Sanjeev Arora will resume to make his address for next 3 minutes.
Sir,
3 minutes.
when my point was interrupted, I was at out-of-pocket expense, which I have already taken care of, and I have mentioned quite a bit that we are on a very higher side as far as out-of-pocket expenses are concerned in our country. Now, sir, coming next on AIMS. There have been 23 new AIMS hospitals, but there is a shortage of faculty of 40%, almost 40% in these AIMS, and also non-faculty positions are around 30% less in AIMS. So my request is that if the budget is increased, we can afford to pay them more and get this get more professors, faculty and non-faculty positions for our hospitals. Sir, now coming to regulations on private hospitals. Sir, private hospitals charge arbitrarily across states, for one reason, that there is no control over the charges being charged by them. Consumables and diagnostic tests overpriced due to lack of price standardization. Also, it is observed that even after setting ceiling prices in some cases, like stunts, knee replacements, the hospital charges are increased. So it comes to same. I'll give you an example, sir. I have bills. One is from a corporate hospital and one is from open market. From the open market, the same thing is available for 64 rupees, whereas the same is available in institutional hospital for more than 300 rupees. Because, sir, once you are admitted, you are a IPD patient. Now they may charge anything. There is no one to control. अब आप ये तो कह नहीं सकते कि मैं ग्लव्स बाहर से लाऊंगा, ये आप कह नहीं सकते कि मैं टेस्ट कराने बाहर जाऊंगा. तो जो भी कराना पड़ेगा, जो वो हॉस्पिटल कर रहा है वो करता है. करें, ठीक है, बट कोई तो कंट्रोल होना चाहिए. सारे स्टेक होल्डर्स को लेके इनटू अकाउंट देयर शुड बी some control regarding this. And sir, next, ESI. Sir, at presently, under ESI, 21,000 rupees who get are covered. And this has been going for long. So my request to government, through you to government, is to increase this limit so that more and more workers are covered under ESI and they can get affordable health treatment. And now, sir, coming to professionals, we were just discussing medical education and our students going abroad. Sir, we have 109,000 UG seats in India, the undergraduate MBBS seats, whereas PG we have only 70,000, which means that after UG, most of the doctors who finish MBBS, they are going abroad, because hardly you see these days MBBS doctors. Any doctor who is practicing has MD on them. So this brain drain somehow needs to be stopped, and we are already in shortage even in AIMS hospital, where government can afford to pay doctors more, which I have brought up before. And also, sir, there needs to be a stricter law on unethical practices. Now, let me give you an example, sir. The cesarean cases, WHO has recommended that it should be 15%. No more than 15% on an average cesarean cases should be there. In our country, in some states, it's more than 50%, sir. So unethical practices should be stopped and commercial motives should be And also there needs to be some health insurance norms where GST point has already been brought, needs to be taken out of health insurance, because even compared to other countries, the percentage of people insured in our country are very minimal. Now, sir, before I end I would like to call upon the government to take the following steps: increase healthcare expenditure at least to 2.5% of GDP, if not 5%, which has been recommended by State Bank of India recently. Regulate private healthcare pricing, revise ESIC wage ceilings, strengthen AIIMS faculty and public health infrastructure, expand insurance coverage for vulnerable population and currently uninsured missing middle class, curb unethical